Ciproflaxacin belongs to a drug class called fluoroquinolones, which are a subgroup of quinolone antibiotics. Fluoroquinolones are synthetic broad-spectrum antibiotics used to treat various bacterial infections. Ciproflaxacin is classified as a second-generation fluoroquinolone, notable for its potent activity against gram-negative bacteria, including Pseudomonas aeruginosa and some gram-positive bacteria. It is commonly used systematically to treat infections such as UTIs, respiratory tract infections, and gastrointestinal infections.
Ciproflaxacin is a fluoroquinolone that's really absorbed orally with about 70% bioavailability and peak levels reach in 1 to 2 hours. Its absorption decreases when taken with calcium, magnesium, aluminium, ionosine solutions to avoid antacids, dairy products and multivitamins for 2 hours before or after taking it. So the drug distributes well into the most tissues, especially the lungs, kidneys, liver, prostate and bones. But it has poor cerebrospinal fluid penetration, partially metabolized in the liver through CYP-A12, which may lead to interaction with drugs like theophylline, caffeine and warfarin. Ciprofloxacin is mainly excreted by the kidneys with 40 to 50% eliminated unchanged and a half-life of 3 to 5 hours. So, those adjustments may be needed in renal impairment.
Fluoroquinolones are bactericidal antibiotics that act by inhibiting two essential bacterial enzymes, DNA-gerase, also known as topoisomerase 2 and topoisomerase 4. DNA-gerase is responsible for introducing negative supercoil into bacterial DNA, which is necessary for DNA replication and transcription. Topoisomerase 4 plays an important role in separating replicated chromosomal DNA during bacterial cell division. By inhibiting these two enzymes, fluoroquinolones prevent DNA replication, transcription, and DNA repair, leading to bacterial cell death. This mechanism is selective for bacteria because human topoisomerase are structurally different. Fluoroquinolones at CB concentration depending killing, meaning higher drug concentration result in faster and more effective bacterial killing. They also demonstrate a post-antibiotic effect where bacterial growth remains suppressed even after drug level fall below the minimum inhibitory concentration. These prompts contribute their strong bactericidal activity. Fluoroquinolones are broad-spectrum antibiotics with strong activity against gram-negative bacteria such as E. coli, Salmonella species, and Pseudomonas aeruginosa. They are also active against gram-positive organisms and atypical pathogens. Resistance may occur through target site mutation, reduced drug uptake, efflux pump activation, or plasmid-mediated mechanism.
Next, the drug class. Ciprofloxacin belongs to the class of drugs known as fluoroquinolones antibiotic, which is second generation of fluoroquinolones. Next part is drug dosage. For adults, 250 until 750 mg orally every 12 hours, depending on the infection type. For intravenous, 200 until 400 mg every 8 to 12 hours.
Ciprofloxacin works by inhibiting bacterial DNA synthesis, which leads to the death of bacteria. Its therapeutic effect is in the treatment of various bacterial infections. It is commonly used for urinary tract infection by killing bacteria such as E. coli, helping to relieve symptoms like pain or burning during urination. It is also effective in gastrointestinal infection, where it stops bacteria like Salmonella and Shigella from multiplying, reducing diarrhea and fever. In respiratory tract infection, ciprofloxacin fight bacteria such as Pseudomonas and Haemophilus influenza, helping to clear chest infection. Additionally, it is used for skin and soft tissue infection, bone and joint infection, and as post-exposure treatment for anthrax. However, ciprofloxacin may cause side effects. Common side effects include nausea, vomiting, diarrhea, abdominal pain, dizziness, and headache. Some patients may also experience rash, itching, photosensitivity, insomnia, joint and muscle pain.
Important adverse effects of ciprofloxacin include arthralgia or joint pain and pseudomembranous colitis, which causes severe diarrhea and needs urgent care. It can also cause erythema nodosum, presenting as painful red skin nodules, and Stevens-Johnson syndrome, a serious blistering skin reaction. Lastly, it may lead to reversible blood disorders like anemia, leukopenia, or thrombocytopenia, which usually improve after stopping the drug. Ciproflaxacin is contraindicated in patients allergic to ciproflaxacin or other quinolones. It must not be used with tizanidine due to the risks like severe low blood pressure and drowsiness. In pediatrics, it's limited to specific infections because it can cause joint problems. It also carries risks of tendon or joint damage and may affect the nervous system, causing seizures or increased intracranial pressure.
For safety management, ensure adequate hydration to prevent crystalluria and maintain good kidney function. Administer at the correct time, preferably on an empty stomach, and avoid concurrent intake of dairy or mineral-containing products. And lastly, ensure correct route, dose, and preparation. Ciproflaxacin may be given orally or IV, but IV doses must be infused slowly over at least 60 minutes to minimize irritation and adverse effects.
In general, patients should be instructed to complete the full course of Fluroquinolones as prescribed, even if symptoms improve early to prevent antibiotic resistance. They should be aware of allergic reactions such as rash, facial or throat swelling, and difficulty breathing, and seek immediate medical attention if this occurs. Patients must report serious side effects promptly, including tender pain, severe dizziness, confusion, irregular heartbeat or numbness and tingling sensation. The medication should be stored in a cool, dry place away from the sunlight and moisturized. And patients should inform healthcare provider about all other medication they are taking.
Intentionally help teaching for the patient about side effects. Report tendon pain, muscle weakness or irregular heartbeat immediately. Maintain hydration to prevent urinary crystals.
When taking ciproflaxacin, dietary considerations are important to ensure the drug works effectively. Patients should avoid taking ciproflaxacin together with dairy products such as milk, cheese, or yogurt because this product can reduce drug absorption. Ciproflaxacin should be taken at least 2 hours before or 4 to 6 hours after consuming this product. Next, patients should drink plenty of water to prevent kidney complication and support recovery. And then balanced diet should be practiced, like avoid excessive caffeine intake because ciproflaxacin can increase the effect of the caffeine leading to insomnia.